Hi everyone, today I'm here with another topic, pneumonia. So let's begin to know what is pneumonia. So pneumonia, it is an infection of the lung tissue that will lead to inflammation. The organisms that can cause pneumonia are viruses, bacteria and fungi. Pneumonia is classified based on the organisms also. So viral pneumonia, the name itself suggests that it is caused by viruses such as influenza, cytomegalovirus and respiratory syncytial virus, or it is also known as RSV. Bacterial pneumonia, it is caused by the bacteria Streptococcus pneumonia. It is known when the pneumonia happens. It is commonly caused by Streptococcus pneumonia and Staphylococcus aureus. Atypical pneumonia, it is caused by certain kinds of bacteria such as Mycoplasma pneumonia and results in a slightly different type of diagnosis. It is also known as walking pneumonia when symptoms are less severe for the person. Other kinds of pneumonia are also there, but they doesn't fit in these categories and they are very rare, and it includes the infection that are caused by fungi. Now, pneumonia is also classified based on the settings and the environment also, where the individual is. Some of the pneumonia are hospital-acquired pneumonia, or also known as nosocomial pneumonia, which occurs at least 48 hours after the patient gets admitted to the hospital. The broader term for health-acquired pneumonia is sometimes used to include the pneumonia that is contacted in other healthcare settings, also like nursing homes. Community-acquired pneumonia, so the name itself suggests it occurs in the community where the general population is outside the healthcare settings. Immunocompromised patients are mostly prone to these infections of any kind of, as we know, when our body is weak, we are not able to fight against diseases. Now, aspiration of foreign substances. When one person aspirates in a foreign substance, it can result to aspiration pneumonia. So, what are the substances? It can be stomach contents or saliva, which can introduce organisms into the lower airway. So, as we always state that when you are giving fluids, be cautious. If the person will aspirate, what will happen? It will go into aspiration pneumonia. Inflammation and infection are the common ones. Chemical pneumonitis, which results from inhalation of toxic substances, irritation to the lung tissue, which can cause inflammatory response. Now, normally spontaneous breathing. When what happens when a person normally spontaneous? The air is inhaled through the upper respiratory tract where it is warmed and filtered before it reaches to the lungs. The air is traveled through the trachea, then to the bronchi, bronchioles and alveoli where the gaseous exchange happens. Oxygen from the air in the alveolar sacs is exchanged for carbon dioxide in the bloodstream at the alveolar or pulmonary capillary wall. Oxygen moves into the bloodstream, carbon dioxide exits the bloodstream, and blood delivers oxygen to the cells of the body. Microorganisms can invade the lungs through the upper respiratory tract if filtering defenses are diminished, such as during the presence of upper respiratory tract infection through aspiration. If pathogens are present in the bloodstream, as in sepsis, they may also enter the pulmonary capillaries. The presence of organisms in normally sterile lower respiratory tracts can cause irritation of the tissues. The inflammation of the alveolar sacs can be filled with the fluid, which includes the blood cells or pus. Alveoli are already filled with liquid. What will happen if the alveoli is filled with liquid, unable to fill with air during the inspiration, which will impair the gaseous exchange? Signs and symptoms. Coming to the signs and symptoms, the first is infection, inflammation will be there, fluid in the lungs will be seen, impaired gaseous exchange will happen, mild to high fever will be there, sweating and chills. This is a common indicator of the pneumonia and it is a favorite NCLEX question also. Chest or pleuritic pain, as we know what is pleuritic pain. When you rub two stones together, there will be a sound will be heard. So that is, or when the sandpaper is rubbed between together, what the sound is there. So that is the pleuritic pain. So shortness of breath on exhalation, fatigue, headache, body aches will be there, nausea and vomiting will be seen, and cough will be present in the person, which will be active. Confusion is or mental status changes is also alarming for the patient with pneumonia, especially in the patient with elderly population. Tachypnea is another symptom where the patient person will try to compensate by during the decreased gaseous exchange, and there will be increased workload during the shortness of breath where the person will be using their accessory muscles. The common way to assess for the pneumonia for persons are through pulse oximetry, which may reveal less oxygen saturation in the blood. Decreased oxygen is visible in form of cyanosis of the skin. Common cyanosis occurs in the nail beds, mouth, and lips, and which is known as circumoral cyanosis. Now, there are different other methods, that is through the sounds also we can we can know the person is having some of the abnormalities in the lung. So it can be adventitious sounds auscultated in patients with pneumonia. Bronchial breath sounds normally auscultated over large areas like the trachea. Consolidation, as we have hearing always these terms, consolidation. So it refers to solid or dense tissue that occurs with pneumonia as a result of the fluid filling alveolar sacs, which can conduct sound better than air. Now, which people are at high risk of having pneumonia? Those with having any infections of lung like asthma or COPD patients, immobility, mechanical ventilated patients. Diagnosis of pneumonia is done through the patient's history, physical examination, through diagnostic tests like chest X-ray, sputum culture, which is collected by asking the patient to have a deep breath and cough into the sterile container, and the culture is sent to identify which organism is present that is leading to infection for the. Now let's start with the management. Treatment is usually based on the organism that the person is having and the symptoms persisting for the person. Bacterial pneumonia, it is treated with appropriate antibiotics or combination of antibiotics. Viral pneumonia, it is treated with antiviral medications. Pneumococcal vaccine are advised for the person who are over 65 years old and with older and having streptococcus pneumonia. Influenza vaccine with the persons who is having influenza virus. Infection prevention measures has to be advised to the person by wearing proper mask and using hygienic techniques. Supplemental oxygen to be given if the patient is having less saturation. Hydration. We have to encourage the patient to have as much as fluid because it will help to loosen the secretions. IV fluids can be advised. Medications like acetaminophen or ibuprofen has to be given if the person is having fever. Oropharyngeal section is recommended if the person is not able to clear out the secretions. Just physiotherapy is another method to loosen the secretions. Educating the patient to complete the medication course. So let's have a look on N class question. The nurse is reviewing the discharge instructions with the patient who was admitted for pneumonia. Which of the following statements made by the patient indicate? So remember, indicate the need for further education. So here the patient need further education. The key terms are indicate the need for further education. So the first option is, I should take rest of my antibiotic medicine on schedule until it is all gone. So this is correct. The person is saying that I should take all my antibiotics. He is compliant with the medications. I do not need to worry about getting pneumonia again since I have had it already. So is this statement you think it's right? No, here the person is saying it's opposite. Does it matter that if a person is having have already suffered from pneumonia, he cannot suffer later on with pneumonia? No, it doesn't. I will continue to drink plenty of water at home. So that we have already read. Hydration is an important part. My grandchildren are traveling to come visit me in 3 weeks. Does it matter that anyone visiting the person with pneumonia? No, it doesn't matter. Thank you to watch my video.